question of any visible anatomy underlying the implant. And if we look at mavrek, it starts showing everything very clearly. Of course, in this case, there's a problem on the opposite side, which was a tubercular hip. So mavrek is the way to go when we are going to be looking at post-operative. In fact, this is an intramedullary nail, and this we did just to show that even the callus that is formed in this fracture can be seen very well. You can suppress the artifact to that extent. And this is, for those who may be interested, multi-acquisition variable resonance image combination, and this goes beyond Mars, as we can see. That this is a standard Mars sequence, and that's mavrek with everything you're able to see in this case. The bones, the intra-articular structures, the fusion, all of that seen very well. Another example, just to highlight the fact as to how useful mavrek is, that's standard Mars, and this is mavrek where you start seeing all the details around the knee joint. A 64-year-old history of revision, TKR, following an infected implant and treatment with ATT for 20 months, now complains of pain and inability to bear weight. This is what a standard Mars sequence showed, and this is mavrek, where you can see that there is this hyperintensity that we see in the adjacent to the femoral component. So there's infection here. Of course, we see a lot of effusion, and this was also pus. But with this, there is no choice but to go in for a further re-revision. Another 24-year-old THR done, and history of left hip pain since 3 months. And this is what it shows. There's loosening with edema in the left superlateral acetabulum. As you can see here, you can see that the sequences, all sequences we can get here, T1, we can get FSC T2, we can get stir, fat suppressed, all of these can be obtained. And so even subtle abnormalities can be seen very well. Another 62-year-old history of pain, instability post-TKR. They wanted to look at the ligaments. And this is Mars, that is mavrek, and you do see some changes here. But what you see on the coronal is these fluid clefts that we see under the tibial platform. And of course, we can see that the medial collateral ligament is intact. So this was aseptic loosening in this case, which also, we did academic CT in this case, and that could be seen here as well. Even on CT, if we have a dual energy CT, then the artifact that you get from metal on a CT scan can also be massively suppressed. Then we have ARMD, which is where you may have metallosis, inflammatory pseudotumor, the alveolar lesion, aseptic lymphocytic vasculitic associated lesion, and of course osteolysis. This is a case of metallosis. So how to differentiate infection from some other cause for pain, swelling, and here you can see this artifact which is coming from, and this is again a mavrek sequence. You see on the synovium these artifacts which are coming, which represent metallosis. This is a case with an alveolar lesion where you see synovial thickening, and this central hypointensity is very typical of an alveolar lesion, and so we can differentiate between that. This is yet another case, bilateral THR, and here you see there's osteolysis, which is seen very well with inflammatory pseudotumor as well, which can be seen on mavrek. And this is what you see on the CT scan. Another case, history of foot drop following TKR. Of course, we did suspect infection in this case. And even there, you're able to see the nerves very well around the joint. And this was a case where there was a fracture of the fibular head. and you know, a trauma to the adjacent common peroneal nerve, which actually caused the problem. Here you can see again better the edema around the fracture site, and of course you can see the implant. This is another case again with this uh, implant in place, and this was, we were trying to see there was a radial nerve injury or has that happened? And this is radial nerve proximal to the groove, and this is radial nerve distal, could be seen very well even on the axial. And we felt that there was entrapment of the radial nerve in this case. Apart from MR, we of course also have, we used to do in the past WBC labeled bone scan, which now has been discontinued. The material is no longer available since it was biological, and it has been discontinued across the world. And what we use now is PET-CT, which can also show you infection very, very well. As in this case, the advantage of a PET-CT is that CT is also part of that examination. Again, yet another case showing the infection on a PET scan, in this case where there was bilateral TKR done. And this is a case of cervical osteomyelitis following surgery, again seen very well with PET-CT. MR in these cases will show you changes, but you're not sure whether, especially in the immediate post-operative period, whether this is infection or just post-operative change. There's very limited role of AI in infection. However, there's an increasing role of AI in orthopedic imaging for lesion identification, quantitative measurements, automatic report generation, triaging and raising critical finding alarms, especially fractures. And across the world, the algorithms which show up fractures automatically are being used in triaging and especially in the dead of the night, and multiple body parts and in orthopedics, spine, joints, whole limb imaging, in all of them, AI is coming in. But as yet, we have nothing globally as far as the use of AI in imaging for infection is concerned. With that, thank you very much for this